Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. How are you? Thank you and welcome to our clinic this weekend. Today we're going to talk about IVF. So, what do you understand by IVF? Who needs IVF? What are the steps involved in IVF? So, this will be my topic this afternoon. I'm planning to go straight to the point, and I'm going to spend approximately 30 minutes, depending on how the flow of the clinic will go. So, today we're going to take a critical look at the process of IVF. What does IVF mean? Who needs IVF? What's the criteria for IVF? What are the steps for IVF? How soon should you embark on IVF? So, by way of introduction, my name is Dr. Chudi Ufundu. I'm the convener, and I strongly encourage you to join this clinic today. And please announce your name. And once we have a good number, I'm going to start. It's going to be pretty straightforward, and you're going to learn a lot of things, especially what you need to do to become a mother, to become a father. There are so many families who the only options left for them as of this time is IVF. If you happen to be in this list, there is nothing you can gain by wasting more time, because when you have an indication for IVF, it's more like the last bus stop. IVF is not for everybody. IVF is for select people with select issues, select factors. Now I'm going to start. IVF stands for in vitro fertilization. In vitro fertilization. So in vitro means fertilization outside the tubes. The opposite of IVF is in vivo fertilization. In vivo means fertilization in the tubes. The natural process of fertilization is for the sperm to come in during the act of lovemaking, during ejaculation, during the deposition of the semen in the vagina. It will pass through the vagina, go through the cervix, get to the womb. Then the sperm that will participate in the process of pregnancy will go to the tubes. Fertilization naturally will happen in the tubes, a special place called the ampulla. However, if you have an indication for IVF, that means if you have a reason, a medical reason, a genetic reason, an age-related reason to go for IVF, this process will not happen. Fertilization will happen outside the body of the woman. So what are we going to do? First of all, we have to investigate and confirm that you are a candidate for IVF. IVF is not for everybody. IVF is not your first line of treatment in infertility. Once we confirm you are a candidate for IVF, we are going to run some tests. We are going to check your partner. The most important factors in IVF is the egg and the sperm. So in the process of IVF, we pretty much will get the eggs, we challenge the ovaries, monitor the cover of your womb, which is called the endometrium. We go to your partner, we check the sperm by doing seminal fluid analysis, looking at three things: the motility, the morphology, and the count. Once we are sure that your male partner has quality sperm, we are gonna keep him at bay. We will collect his sperm. Semen contains millions of sperm. Remember the difference between the semen and the sperm. Semen is what you can see at the peak of ejaculation. Sperm is invisible. So once your partner has adequate parameter for quality sperm, the count, the morphology, and the motility, we are gonna mark him good. So we're gonna classify his sperm in grades, grade A, B, C, D. Grade A is the most important grade. That means the quality of the sperm is good. That means the motility is good. Of the three parameters, motility is the most important thing, because we want the sperm that was deposited in the vagina to be able to go up. In the process of IVF, we are not going to use the body of a woman for now. Now we go to the woman, we challenge the woman's ovaries. First of all, we are going to give the woman oral contraceptive pills to hijack the system. Then we begin what we call stimulation. Stimulation is to give a couple of drugs which will now go to your ovaries. Your ovaries naturally will produce one egg during ovulation. But when we are going through IVF, we are not interested in one egg. We'll challenge the ovaries to give us multiple eggs through the process of super ovulation or hyper ovulation. Now we are going to make sure that the eggs are good. Once we are sure that the eggs are good, we are going to keep an eye on the endometrium. Endometrium is the cover of your womb. So the three important factors in the body of a woman that must work together to aid the process of IVF is what? The ovaries must be fully functional. We have to check the follicles, we have to track the follicles and make sure that the ovaries are responding appropriately to the drugs. Then we check the endometrium. We have to make sure that the endometrium is thick enough to support pregnancy. Once we are sure that the woman is doing okay, we will collect the eggs through a special process. When we collect the eggs, by then we would have confirmed that the man's sperm is good. We are gonna join the eggs. We also grade the eggs, grade A, B, C. This is an area that many women are getting it mixed up. There are some women that have just 1 year to become pregnant. Once you miss that 1 year, you will enter into menopause. When you enter menopause, you no longer have eggs. When you no longer have eggs, you can no longer have a baby naturally. So once we are sure that you're responding properly, we'll collect the eggs. The eggs are going to be graded A, B, C. So A is the highest, B is fair, C is good. So we want it to be the highest you can be. So we keep a couple of the eggs and we mix them together with the sperm outside the body of the woman. So this is where the difference comes. In natural pregnancy, which is in vivo, the man will insert the penis, deposit the semen, it will go to the tubes and fertilization will occur. But in IVF, the man will just produce the sperm, keep it in the lab. We collect the eggs from the woman, we join both of them together to form embryo. Once we have succeeded in having quality embryo, we're going to keep a couple of embryo within you, so long as they are good quality. Some embryos we have certified good, then we go back and we transfer it into the body of the woman. After 14 days, which is approximately 2 weeks, it's expected that this woman will test positive in pregnancy. Once pregnancy has occurred, it will be exactly the same thing with natural process of achieving pregnancy. This, in a nutshell, is what IVF is all about. Now, IVF is not for everybody. There are some people that don't need IVF. They need to just become pregnant naturally. But there are some women that must go for IVF. That's the only options you have. So people might choose IVF for so many reasons. The major reason why you might choose IVF is because of infertility problem. So infertility is defined as the inability to succeed in becoming pregnant after a period of trying, which we don't like using in this group. So if you and your partner are using our method, which is praying means regular lovemaking, and practicing means getting a subscription. If after 12 months, if you are younger than 35, after 12 months of being with your partner and everything is not working and you didn't get a positive pregnancy test, at that point you are considered as someone having infertility. You require IVF. If you are above 35 and after 6 months, there is no pregnancy, you have infertility. If you are from 40 and above, we don't even waste time, we go immediately. So number one reason why you might likely be a candidate and you have to go for IVF is infertility issues. I'm going to mention a couple of the infertility issues that will warrant you to go for IVF. Number one, and the most important factor, is when your two tubes are blocked. Your tubes are the mechanical means that will transport the eggs, transport the sperm, transport the fertilized egg, which is now called the embryo, to start implanting. If both sides of your tubes are blocked, the eggs cannot come in, the sperm cannot come in, pregnancy cannot happen. So if you have confirmed blocked tubes, if you went for hysterosalpingograph, which is the test we use in checking if your tubes are open, and we discover that your two tubes are blocked, you can cry for a little while. When you're done crying, you have to go and look for money for IVF, because naturally, the process of pregnancy will not happen. So number one, people who will require IVF only to become pregnant is women that have both tubes blocked, completely blocked. Some women might have mild blockage and they go for HSG and they are good. Some women might have moderate blockage and they can go for some procedure for flushing or for treating the tubes through surgical means in a very carefully managed environment, and they can restore the integrity of the tubes. But be careful, if the tubes are damaged and fertilization happens and is refusing to go and start developing in the womb, that pregnancy is not a good pregnancy. That pregnancy is a deadly pregnancy. It's called ectopic pregnancy. We don't want any woman to have ectopic pregnancy. Number two, some women might have what we call endometriosis. When you have endometriosis, the cells that cover the womb will be seen elsewhere, and when they go elsewhere, they begin to cause problems. So if you have endometrial cells in the ovaries, it will cause endometrioma, affecting the function of the ovaries. If you have endometrial cells in any other place outside the womb, they will cause problem. So women that have severe endometriosis are candidate for IVF. Men that have irretractable low sperm count. So if your partner has low sperm count, we're not just going to go for IVF. We're going to go for a special type of IVF called ITSC, intracytoplasmic sperm injection. This is a different superior type of IVF. We're going to get the egg, we're going to get the sperm, and we inject the sperm directly to the eggs. Now, women that have polycystic ovarian syndrome, this is a condition that can damage the original function of your ovaries. You're also a candidate for IVF. There are some women that might have very debilitating fibroid to the extent that it has damaged the architecture of your womb and sometimes the tubes. You are also a candidate for IVF. Women that have any problem with the womb, any structural problem with the womb, might also be a candidate for IVF. Women that have genetic disorder, there are some genetic disorders that will not warrant a woman to have a baby naturally. You might also be a candidate for IVF. Now, there are some couples that will have what we call unexplained infertility. So these are the women that will definitely require IVF. Now, classically, there are some categories of women in our group who must be very careful, especially as we are ending 2022. If you happen to find yourself in the age of 35 and above, you are now classified as advancing maternal age. So if you get to 35 and after 6 months, we have tried other means and we are not able to succeed, IVF is your option. If there are some medical condition we want to avoid, which will ultimately affect the outcome of pregnancy, IVF is your option. So any woman who is in advanced maternal age, and matter of fact, is 12 months of trying, of believing, of trusting God to be pregnant, but it's not happening, IVF should be in your table. If you have tried other methods of treatment, fertility drugs, IUI, and all that, and it keeps failing, IVF is your option. So this, in a nutshell, is the reason why you need to consider IVF. Now, there is absolutely nothing wrong in going for IVF. IVF is as old as 46 years. The first IVF was done in 1970s in England, and Louise Brown, the first product of IVF, is happily doing her thing, and there are thousands, if not millions, of babies that have been delivered through IVF. So please, the opposite of not having IVF is not having a baby. Let nobody deceive you that IVF is evil. IVF baby is this. IVF mother is this. There is no merit. There are some women that would need to multiply, easily have twins, triplets, quadruplets, if the factors favor. So do not spend the coming 12 months in 2023 still doing the same thing you're doing or rejecting IVF. There are some women that need to go for IVF, but because they don't buy into IVF, by the time they're ready, they no longer have eggs. So there are some women that the only type of IVF they need is donor eggs. So if your eggs are not of good quality, how do we know that your eggs are not of good quality? Number one, we have to estimate the quantity through the process of running your anti-Mullerian hormone test. If your anti-Mullerian hormone test is telling us that your AMH is low, then you are a candidate that should consider using donor eggs. So matter of fact, as a rule of thumb, in our community, if you're planning to go for IVF, we strongly encourage you to grab our guide. Admin, I don't know if you can share the guide here. Grab the guide to IVF, understand the process, understand your rights, understand your expectations, then understand when you need to intervene, understand the role of your partner. Getting pregnant is not just about the woman, it's also about the man. So I want everybody to analyze and take your option. We are all gonna become parents. We are all gonna become mothers and fathers, but we are not gonna become mothers and fathers one way. There are so many other ways of becoming mothers and fathers, and IVF is one of them. Matter of fact, IVF is the last bus stop for any couple having infertility. So you won't be having infertility and immediately I say, oh, you're going to do 5 years. No, that's not how it works. We would have tried other methods, and if it fails, then we switch to IVF. Now, how long is IVF process? It depends. Some women can easily do better by all the investigations, and it can end as soon as 2 months, some 3 months. Now, some people might need to go over and over again, depending on how you react. So the duration of your IVF and the outcome is based on your age, the way your body responded to the stimulation, the quality of your partner's sperm, and the availability of the facilities where you're doing the IVF. There are so many people that claim to be doing IVF, but they are not really experts. So before you want to go for IVF, make sure you're going in the right place. And we can refer you in this regards if you live in Nigeria. Now, the clinic has ended. I'm going to start taking care of your questions. My presentation is done. Please start asking your question. I want you to ask me clinical, critical question about IVF. If you're planning to go for IVF and you live in Nigeria, I want to tell you a good news. We can hold your hands. We can get you to someone that will care for you from day one until you have your baby in your hands. So what am I trying to say? You can get a package. I can refer you to Lagos. I can refer you to Abuja. I can refer you to Enugu. I can refer you to Oka. You can go to these places and you can get your IVF done. And by the special grace of God, you can even succeed in having twins. You can succeed in having triplets. You can succeed in having quadruplets. Matter of fact, the older you are, the more the likelihood of you having multiple pregnancy. So elderly women have an advantage compared to younger women regarding IVF. So please start asking me your questions very straight to point. I'm going to keep to time because we are running a very tight schedule this weekend. Immediately after this clinic, I'm going to go to Facebook and we're going to repeat this topic. This is an opportunity for you to take both steps. Some people can actually start the process of IVF. And if your IVF provider is available, by the coming of January, you would have completed your cycle. And by March or thereabout, you would have become pregnant. So take that options today. Not doing anything is not an option. You have to do something, okay? Guys, ask me questions immediately. Is there any side effect on the woman after IVF? Now, I'm not going to say no, and I'm not going to say yes. It depends on the constitutional factor of the woman. Now, there are one of few immediate reactions you can have because when we give you all these drugs, they are hormone-related drugs. So some of them can lead to mild side effects here and there. Bloating, mood swings, pain, reactions in the area, because we're going to be giving you a lot of injections. Any woman going for IVF, your partner needs to be a doctor because we will teach your partner how to give injections. So some women can have reactions about the injection side. Some women can have breast tenderness, bloating. And unfortunately, if you have predisposition to develop a couple of medical problems, like for example, if you have cancer in your family, by the time we are introducing all those hormones in your body, some of them might fine-tune those cancer from developing. So that's the reason why you need to be careful. And there has to be a point where the IVF provider will tell you the truth and say, you know what, we are going to give you a break. The more you go for IVF, the more you expose yourself to risk factors, the more you expose yourself to adverse effects, because we are introducing exogenous hormones into your body, foreign hormones into your body, and our body doesn't want anything foreign. That's why it's purely monitored by experts. There are some women who will cancel their IVF if we feel you're not reacting properly, or if you feel you have some medical conditions. We are not going to go through IVF. You might go to surrogacy or you go to adoption. So the process of the side effect or adverse effect is based on your constitutional factor. So this is a profile that your provider will run. Your provider will ask you about your past medical history, surgical history, family and social history, maternal history, paternal history. So if a woman has predisposition for breast cancer or cervical cancer, then we are gonna be careful when we begin to give you these drugs, because there are so many injections we are gonna give you. There are so many drugs we are gonna give you, and some women might have some adverse effects based on these medications. I'm loving the questions this afternoon. Quinette Davison, how do one know that she's a candidate for IVF? I love the questions. If you notice, I mentioned a couple of medical problems. Number one, if you are above 35 and you and your partner have been doing the right things to become pregnant, which is regular lovemaking, and pregnancy is not happening after 6 months, you're a candidate for IVF. So advancing maternal age without outcome in pregnancy is a criteria. If you have endometriosis, is a criteria. If you have troublesome fibroid, is a criteria. If you have unexplained infertility, is a criteria. If you have polycystic ovarian syndrome, is a criteria. If your partner has either azoospermia or oligospermia and he's not getting you pregnant, is a criteria. So there are some medical indication that will place you as a candidate for IVF, but it's not for you to ascertain. You have to go to a gynecologist. A gynecologist will refer you to a fertility specialist. That's the only way you can know if you're a candidate. So you can't just say, hey, doc, I want IVF. It's not for you to make that decision. Your doctor would have tried other methods. And if you're not yielding results, then your doctor will make sure that IVF is your option. Okay? All right. For a woman above 40, is it advisable for her to use her eggs if she's going for IVF? This is a very important matter of fact. Chinyere just asked the most important question in this clinic. Now, the criteria for going for IVF is the quality of your eggs. So unfortunately, when you get to 35, both the quantity and the quality of your eggs will depreciate. By default, the number of eggs will come down, the quality of the remaining eggs will come down. So it boils down to the outcome of your anti-Mullerian hormone and some other indices. So when we keep an eye on the follicles and we encourage that the eggs will retrieve our good quality, then we can use your eggs. So it's a case of what you have. Now, generally for women in our community, when you get to 40, we normally encourage them to also explore donor eggs, because at 40, not just that the eggs might not be of good quality, so many women will have miscarriages. So many women might be predisposed to chromosomal abnormalities, because the older you are, the more the possibility that the eggs you have might be abnormal. So at any stage, a woman has good eggs, bad eggs in ratios. The younger you are, the more the good eggs you have. The older you are, the more the abnormal eggs you have. So personally, and in our group, we encourage women about the age 40 to keep donor egg on the table. Now, some women can naturally become pregnant at age 40, and some women can also use their egg. So it's the outcome of your fertility test that will determine if you will use your own eggs. Now, I don't want you to bother whether it's your own eggs or donor. It doesn't matter. They will both use the baby, and that's what you will become, a mother. And your baby will be your baby. Nobody will take your baby away from you. So don't go thinking, oh, am I going to use my eggs? And before you blink, you don't have eggs. Because if you don't have eggs in the first place, what are we going to do? When you don't have anything, you need help. Okay? Now here comes COO. Is there any difference in pregnancy resulting from IVF versus pregnancy resulting in natural conception? I knew she was going to ask a very technically and very meaningful question. Now here's the deal. There is absolutely no difference. The same exposures, the same outcome you will have in naturally achieved pregnancy and IVF is the same thing you have. The moment we have completed the process of IVF, which is the transfer, and after 2 weeks, by the special grace of God, you go for your blood test. We normally jump to blood test. We don't want to do urine test in IVF. We just do the blood test because blood test is superior to urine test. The moment we confirm after 14 days that you are pregnant, where is the embryo? Inside the womb. In natural pregnancy, where is the embryo? Inside the womb. Any difference? Absolutely no difference. The factors the natural pregnancy will be exposed to is the factors that the IVF process pregnancy will be exposed to. So what do you need to do? At the stage you've succeeded in becoming pregnant through IVF, your baby is a precious baby. So you have to register for ANC on time, and we monitor you. And majority of women will go ahead and have their baby. If a natural pregnancy will go through miscarriage, unfortunately, we go through miscarriage. If an IVF-mediated pregnancy will go through miscarriage, unfortunately, it's going to go through miscarriage. So there is no difference. The only tiebreaker is what you do when you eventually become pregnant. And this is where your doctor will come in. I love that question, Kenneth. So there is practically no meaningful difference between artificially, which is IVF-based pregnancy, and natural pregnancy. Absolutely no difference. Okay? All right. What's the success rate of women in the 20s going for IVF? Okay, now we should apply this logically. Remember, the younger you are, the better the outcome of becoming pregnant, the more improve your fertility is. So a woman, the best time in a woman's life to have all her babies in 20s. So a woman, for some reason, maybe the partner in her 20s going for IVF, it's like times 4 more chances, more probability of having a good outcome compared to a woman older than 20. So both naturally and IVF, a younger woman will have a greater chance of success compared to an elderly woman. So at 20, very, very good chance. The criteria is because at 20, if nothing happens to your eggs are better and of good quality compared to a woman in their 30s or their 40s or their 50s. So the answer is yes. You have a better chance of success when you're younger. This is the same criteria we use in egg freezing. You see, when you are going for egg donor, we're not going to give you an egg from a woman in her 30s or 40s. No, we're going to give you an egg from a younger woman because the younger egg is more trustworthy. Okay? COO, you have another question. We have 4 minutes, guys. 4 minutes. What about the children born from IVF? There is, as of today, we have one of few anecdotal researches. Oh, the baby will be this, the baby will be that. But as of today, there is no significant difference. There is no predisposition to any particular disease that a baby that was born through IVF will be developed. They are normal babies. They will do pretty much everything other babies are doing. My people, this is no joke. The first IVF was done in the 70s. Louise Brown, she's in her 40s now. And there are so many families that prior to now, they didn't even know they would be co-parents. They are today, not 1, not 2, not 3, not 4. There are so many families that succeeded in becoming parents through the process of IVF. And the kids are doing amazing. The determining factor in how your baby will turn up is what we call nurture and nature. So long as there is no genetic problem in conceiving that baby and the environment is loving and caring enough, every baby will reach their potential. So it's the care you give to the baby that will determine how the baby is going to turn out. Okay? All right. Beautiful questions from beautiful people. Do we still have any question? If not, we're going to adjourn the clinic. I want all the crew members to join me in Facebook. Remember, we have a retreat on the 18th. If your relationship is struggling, listen to me carefully. Love each other. If your relationship is loveless, can no longer identify your partner. If your relationship is lacking romance, no affection, no nothing, is bland, you guys are practically like enemies, please attend and register for our couples retreat, bringing romance back into your relationship on the 18th, 9 p.m. Nigerian time. And this particular event is not just for women that want to have babies. It's for every woman. It's for every man. If your relationship is struggling, we are gonna go there. If you know me, I don't mince words. I'm going to tell you your truth. If your partner wants to adopt the truth, then you guys will have happiness. A baby born into a loving relationship will thrive and make the baby's developmental milestone. A baby born into a loveless relationship, a romanceless relationship, is a struggling baby. Some of those babies will develop psychological problems. So love is important. Remember, before you guys started struggling for infertility, you guys were first friends, then you fell in love, then he proposed to you, and you agreed to marry him. It's not just because to have babies. Love is the reason why you guys are together. So we're going to try to bring back love into your relationship. It's an event you don't want to miss. If you think you've seen the best of me, you're joking. Don't miss that event for anything, okay? All right. Christiana of 4, is that our own Onyinye? So is it any important in having? No, look, blood grouping, so long as the baby's final blood group is compatible, we are not worried. The only time we begin to worry regarding blood grouping is if the partner is positive and the mother is negative, then the mother has to take her organ in subsequent pregnancy. So we're not worried. I know some people, because of the donor identity different incompatibility. It doesn't matter. There are legal documentations that will cover that. I understand where you're coming from. Assuming the baby, the donor, and the blood group and whatever they match the couples on, there are legal documentation that will cover that. But your baby is your baby. So we're not worried about that. Okay? Guys, my time is up. Thank you for coming. Join me in Facebook immediately, and we're gonna repeat this topic and we'll call it a day. Thank you so much for making today's clinic very fun. Until I see you guys, God bless you, and bye-bye for now.